Talks. I'd have actually liked to listen to you the whole day. It's a remarkable speech you made this morning. Unfortunately, I've got a job to do. What I thought was challenges we could possibly try. Now, going back to the history, it takes me right back to the socialist movement in the 19th century. Britain was industrializing, and nobody would know that more than the British ambassador, that Manchester, Liverpool, and all the Midland was the factory of the world, industrializing Britain, the factory owners getting richer, the workers getting poorer, malnourished, dying of hunger and disease in an overcrowded area. And then, that was the time, in 1830s, that the cooperative movement and the socialist movement started in industrialized countries. And to address the need of the really poor, deprived people in the factory, the British government had a law to look after the poor. But that law was misused by the poor. And to create a bit of stricture from misuse of the funds through charity, various charities that the poor had access to, the Royal Commission on Operation of the Poor law was enacted in 1832. That's the beginning of a streamlining of some sort of welfare that was directed towards the marginalized poor people. I often tell my friend, classmate, that Marxism did not come parachuting from Germany. So don't look at it in isolation. Karl Marx wrote his Das Kapital in 1867, and that was the result of the whole Europe moving towards an equitable society as a result of the extreme disparity between the factory owner and the workers as part of the Industrial Revolution. Marx was influenced by the writing of Charles Darwin, and he thought, well, if Darwin can look at the evolution of human being in a scientific way, I might as well look into the political and social evolution of society in a more scientific way. It was not an altogether different philosophy. So he wrote it in 1867. And there are many doctors here. It's the same year that Lord Joseph Lister put phenol in the wound and then started the era of antiseptic surgery. I draw the parallel between these two because our Marxist friends still followed exactly the same thing Marx said in 1867. It's exactly like Dr. Vaidya or me putting phenol in the brain or in the abdomen to control infection today. We have moved on. Instead of phenol, we are using very many strong antibiotics and antiseptics today. Since it is Marxism, it is science, it has to move on. It did move on. Had it moved on, we would not have lost 18,000 precious lives in this country. So ignorant people leading the country is a disaster. I don't put phenol in the wound anymore. So, but then Marxism stirred up big debate in Europe about the right of the poor. And then in Britain itself, around 1906, the liberals were now being challenged by the emerging Labour Party, working for the right of the poor, and the liberals had to do something. And then they introduced the welfare reforms in 1906. And it was David Lloyd George in 1911 who actually enacted the National Insurance Act, which is the sort of thing which we are planning to do at the moment. That people who are employed pay certain tax, and that tax is being reciprocated by the employer, and the government puts some money in, and that fund will look after the health and social security of that particular employee. And we have not even got to that stage in Nepal at the moment. So that's the beginning of some sort of insurance, the social insurance policy in Britain, National Insurance Act. And people thought, well, we might as well look after our poor brothers. And then they had a very serious threat Soviet Russia. If they did not implement socialist reform quick enough, there would be communist revolt. So they changed. So this is the back, and it was Sir William Beveridge's report in 1942, largely pressurized by the labor movement in Britain, that he identified 5 as the giant evils of the British society: squalor, ignorance, want, idleness, and disease. And he precisely recommended that a flat compulsory national insurance scheme for healthcare, unemployment, and retirement benefit, very precise, is the only remedy to prevent this. Of course, he cautioned a bit, but he didn't realize at that time that this benevolent act will have certain flaws down the line, maybe 30, 40, 50 years down the line. That misuse of unemployment benefit will occur. That's where socialism is being challenged by the rightists. That very severely, when I was training in Britain, every day they used to say, why should a working man subsidize a lazy man? So misuse of unemployment benefit, an inherent tendency of human being to get lazy. If somebody else is working and I get the benefit, why should I work? This was not envisioned at that time. And along with that, what they failed to realize, that they thought that the British society will continue to work hard, they will have a good family value, and then the people will save for their children's education and their old age, and then they will continue to work. Unfortunately, that did not happen. With change, social structure has changed, family value has changed, and all these people who were otherwise would have been the responsibility of the family. Now, state has to look after the old people. So state has got a lot of extra burden. These 2 or 3 things were not visualized when the National Health Service was being conceptualized. Well, then the National Health Service came into existence based on the Beveridge report, and the Labour Party's victory in 1945, and that's what they had committed to their people. They were going to bring out a good social security bill, and the voters. They were elected, and then the implementation was done on the same day, on the 5th of July 1948, by a very dynamic Labour movement leader, Andrew Devon, who used to be a ferocious opponent of Winston Churchill in the Parliament. They were literally enemies, debating with Churchill. Very dynamic, very committed, Marxist, started with as a coal miner, climbed it way up, became health minister, and he was instrumental in getting the National Health Service Act. And that was the day Britain became a welfare state, with the philosophy of care from the cradle to the grave. Funding, very simple. General taxation, and there used to be a national insurance contribution from employees, which I paid myself, Dr. Upendra. All the doctors who were there must have paid national insurance contribution. National insurance contribution plus income tax, which should be 40% of our salary as tax and national insurance contribution. So that was used to fund the social security. Did they build new hospitals? No. They nationalized all the existing municipal and charitable hospitals, and these were the hospitals which were providing health care. And will say, could a war-impoverished Britain afford to have such an expensive national health service immediately after the Second World War, when still rationing was continuing? People were not getting, children were not getting even candy to eat. Rationing was in place, and could have. Yes, they did. The clue to that is that if there is political commitment, determination, you can do it. Okay. I think I am running very late. Enormously late. So this is exactly how they are spending. Spending on the health sector. 17% of the total budget. We are spending less than 5%. These are the areas covered in the social security benefit, including unemployment benefit, billions of dollars pound going there. So when I came to Nepal, the reality was quite different. GDP per capita income was $261. Budget in health was very low. Only 62.85% of spending was out of pocket. And then that was the reality in healthcare funding. Even the money put together was not enough to subsidize the essential healthcare service, which is at the bottom of the pyramid. Government was spending around $3, $1.5 from the external development partners, the DFID all put together, and even for primary healthcare, money had to come from the pocket. So the way forward was, I think, essential healthcare service had to be taken care by the government. Secondary, tertiary, maybe health insurance might be a thing. So I started exploring that. So positive attributes, we are naturally risk-sharing community in Nepal. We have got certain goodies, and then Mela Parma out in the community, and the solidarity is deep-rooted in our community. So there is a risk-sharing behavior among the Nepalese. So, but then the organized sector was very little. Only about 32% of the people had some sort of employment. Majority, 68 were unemployed. So introducing the social security, the social insurance would be impossible in Nepal. So we did a lot of preparatory work. Ministry of Health invested in human resource training. I sent 6 or 7 people to train outside in Germany, Bangkok. And we asked for help from DFID. Experts were invited. DFID, ILO, and WHO. And Andrew Green from the Leeds University came to help me. And then we invested, government invested in improving the secondary and tertiary care, so these institutions could be providing the care when we insure people. And I brought out this health sector reform strategy and established health economics and financing unit at the ministry. And Andrew did a survey and found out that there was strong political commitment but the volatile political situation at that time. Maybe he wrote that to perhaps flatter me that I had a commitment, but the political situation was not conducive. The microeconomic condition not conducive to nationwide social health insurance at that time, because very few organized sector, majority were still unemployed. Formal sector, too small to take the risk. Unwillingness of the government employees to share their benefit, which was health benefit, which they used to use as saving. At the end of retirement, they will get it back. So that could not be converted as the health insurance package. So we decided to launch a community health insurance and decided to pilot it. Then I brought the insurers into the ministry and orientated them. Invited everybody. Orientation of insurance companies and insurances. Requested Bima Samsthan to take the lead and invited private companies to see whether you could insure the civil servants, but nobody was coming forward. No help at all. So the ministry decided to go on it. So we established health insurance committee and splitted the human resource in the health facilities into 2. One will be providing, another will be insured. So we did that and chose few villages as a pilot project. And government itself paid the insurance premium for the people to be insured. So these are the benefit packages we worked out. I don't have time to go into the details. And the premium charge was this. And that was the result, impact of that little project. That the service utilization increased from 3 to 3-fold policy compared to going to private sector. Although government was investing, cost recovery increased from up to 60% in 2006. And governance and accountability of the health facilities improved because they had to provide service. Of course, risks and challenges ahead were moral hazards. That's why the insurance company didn't want to come. The client and the agent will collaborate together to build the insurance company falsely. And this is happening now. Some of them which are insured. We issue a bill from the hospital for maybe about 3,000 rupees or 10,000 rupees. Somebody does a lot of doctoring in the bill and then makes it 4 lakhs. And they bill it. So the moral standard is very low. So the insurance companies are at risk. There is adverse selection insured. Healthy people will think that they are never going to be sick and they will not insure. So there will be no risk sharing, and this is called adverse selection in terms of health economic jargon. So treating all sick people is not going to be cost sharing in terms of insurance. And quality of care on the public health facility was not up to the mark for people who are paying through insurance would like to go. We had to improve the capacity of the hospitals where people would like to have them treated. And of course, there is intimidating growth of the private sector at the moment. And even if you give me 2 days, I can talk about poor financing governance in this country. The root of trouble of this country is economic corruption. We are corrupt, except for a few exceptions. we don't pay tax. And the people who are supposed to collect tax will tell you, why do you pay so much of tax? Bribe me, I'll help you evade tax. And even the money collected in the finance ministry's treasury, the minister and the business people sit together and in the name of refund of the tax, they loot the country. Very, very corrupt financial system. You don't need to kill even a fly to improve this country. A good finance minister is sufficient to bring about major revolution in this country. So with this sort of financial corruption, no insurance company will survive. All the companies will go bust. So these are the problems ahead in this country. Thank you. I'll come back again for a second.